Thank you, everybody, for coming. It's a beautiful day out there, and you've done yeoman work to come inside on a day such as this. So thank you. I have two pictures over there, which I can't see from where I'm standing, but I know them well because they're on the wall of my office. On the left, you see a little boy who's an AIDS orphan, and he's being fed at a home for abandoned children. There are 11 million AIDS orphans in sub-Saharan Africa alone. They have no safety net, they end up in the streets, they suffer from poor health, trauma, psychological problems, and making them very vulnerable to abuse and exploitation. There are no vaccines that protect us from AIDS. The picture on the far side is of a young boy holding his sister's hand as she waits for treatment for malaria. It's likely that this little girl died. Imagine the effect of her death on this little boy. Imagine the effect of this death on the parents and on the siblings of this child. Yet there are 200 million cases of malaria each year, and the disease kills almost 1 million people a year. Most of them are children under 5, and yet there's no vaccine for malaria. I look at these pictures every morning when I enter my office. They're a constant reminder of why I come to work each day. And this is also the reason why all my colleagues at Seattle BioMed come to work each day. Now, many of you are longtime supporters. Welcome back, and thank you. And some of you are hearing about our work for the first time. Seattle BioMed is the largest independent infectious disease institute in the country. We have a vast network of collaborators worldwide, particularly in Africa and in Asia. We have approximately 400 employees who come from more than 20 countries. Our 18 faculty direct more than 100 active research programs. Uniquely, we use systems biology, which is a new type of approach which combines cutting-edge technology and the power of computers, and we use this to accelerate our findings. And our major focus is on the big three diseases: malaria, HIV/AIDS, and TB. We do also, though, have programs in other neglected diseases that afflict the underserved. Those include leishmaniasis, toxoplasmosis, and African sleeping sickness. There's a need to study these diseases. 14 million people each year die from them. Now, I originally come from South Africa, and in 1982, I met a woman called Naledi, who lived in a village near the town of Silibipikwe in Botswana. She had 4 children, at that time aged between 2 and 8, and at the time I met her, her daughter Kagiso was in hospital suffering from malaria. She had been admitted to the hospital with a fever, headache, chills, vomiting, and Naledi had to walk 15 miles in the beating African sun to get to the hospital. So she stayed at the hospital with Kagiso. Her other children were not properly cared for. She could not fetch water for them, could not make food. Her neighbors looked after the kids as best they could, but they didn't get enough to eat. Kagiso died of cerebral malaria, and Naledi told me then that 2 other of her kids had also died, which I didn't know about at the time. And she knew that it was highly likely that more of her children would die. She told me that each death was a dagger in her heart. The last time I saw her, her spirit had left her. She was surviving, but she certainly wasn't alive. And she's not alone. Every 43 seconds, a child in Africa dies from malaria. Think about that. As a parent, I cannot imagine the agony of losing a child. And I certainly can't get my mind around to even think about it. It's an extraordinary figure, and we are really amiss. This cannot go on. I also remember thinking, when she told me about her lost children, which of them could have been a Nelson Mandela? More than 1 million African kids die every year from malaria. It is mind-boggling to imagine how much talent is lost. And this was a transformative moment for me in my life. At the time, I was a biophysicist, a somewhat esoteric field. There and then, I resolved that I would spend the rest of my life working on the diseases that afflict the underserved. So what is Seattle BioMed doing about malaria? As many of you know, we have an active vaccine development program. But I'd like tonight to highlight another recent discovery that we've made. One of the most deadly complications of malaria is cerebral malaria. This is the form that kills basically the kids. Cerebral malaria is caused by infected blood cells binding to the blood vessels in the brain. This contributes to decreased blood flow. The kids go into a coma and death follows. Vaccines or drug interventions are desperately needed to improve the outcome of the infection. As I said, at the moment, there are none. It has been recognized for more than a century that the red blood cells that are infected with the malaria parasite kill the host by sticking to the side of the blood vessel. But it's not been known how that happens. In the last 2 years, Seattle BioMed researchers, together with some collaborators, have identified 2 proteins, one on the infected red blood cell and the other on the blood vessel, which causes these 2 things to stick together. In other words, we now have the lock and the key. Knowing these components make it possible to develop a drug and vaccine to prevent or to reverse the binding of the red blood cell to the blood vessels in the brain. Joe Smith and his team carried out this work at Seattle BioMed, and they've been helped by the staff of our mosquito insectary. Believe it or not, the facility produces 50,000 mosquitoes a week. That's a bad week. Joe, will you stand up and be recognized, please? I'd now like to turn to HIV, and to begin, I'd like to quote Nelson Mandela. And he said, "AIDS is no longer just a disease, it's a human rights issue." I've spent a lot of time in South Africa working on the problem of HIV/AIDS. I've been unable to walk in a hospital because there were so many people lying on the floor, I couldn't find a place to put my foot. The suffering is unbearable. People die leaving AIDS orphans. How is a child supposed to grow up without love and guidance of a parent? Hard to imagine. There are enormous consequences to the countries as well. Usually, infectious diseases attack the very young or the very old. In the case of AIDS, the economically active are the ones that are affected, with obvious consequences to the country. There are about 30 million people who are currently infected with HIV, and each year, 2.5 million more people become infected with the virus. A vaccine is absolutely necessary to stop the epidemic, but one of the great difficulties of making a vaccine against HIV is that there are literally hundreds and thousands of HIV variants and strains. So what is Seattle BioMed doing about this? Our HIV vaccine efforts are aimed at eliciting antibodies that will defend against all of the HIV strains. These antibodies are called broadly neutralizing antibodies. In the past 30 years, no one has been able to make a vaccine that elicits broadly neutralizing antibodies. But scientists at Seattle BioMed, with their collaborators, have discovered that previous HIV vaccines failed to stimulate the production of broadly neutralizing antibodies because of the way they were designed. And we have now been able to design new vaccines that induce these broadly neutralizing antibodies, and we hope to test them in the clinic. To quote Nelson Mandela again, AIDS is another war, another impossibility that can still be won. Leo Stamatatos and his team appear to be proving Mandela right. Leo, will you and your group stand up and be recognized? I can't see where he is. Many of us think that tuberculosis was a scourge that has basically been cured. Nothing can be further from the truth. Tuberculosis is a true global disease. Worldwide, TB causes 3 deaths every minute. Perhaps the worst statistic is that 1/3 of all people in the world are latently infected with TB. That is, they're infected, but the immune system is maintaining the bug dormant. I've also worked on TB in Africa. The story I'm about to share with you is somewhat longer than the others I've mentioned, but it captures for me the agony, the societal consequences, and the sheer chaos that surrounds the TB crisis. I've witnessed the events that are described in this story time and time again, but it's told so well and was published in the Sentinel Project on Pediatric Drug-Resistant Tuberculosis that I've decided to read this to you because they really manage, in my opinion, to capture that chaos and crisis. The story is about a boy named Tabo. He was quiet when he died, reported Tabo's auntie. He hardly made a sound. I would almost never have known it if it hadn't been for the flies, really. These were the words that announced the death of 8-year-old Tabo, a small boy who died in Soweto, South Africa. The clinic knew Tabo well. He had first come there with his mother, a young woman who was found to be both mentally ill and to be infected with HIV. She was admitted to the psychiatric ward, and Tabo took to sleeping on the clinic floor until his aunt finally picked him up. Eventually, his mother's health improved, and she came home. Tabo enrolled in school. Although he remained small for his age, things were looking up for him and for his family. That soon began to change. Tabo developed a fever and would sweat terribly at night. He was too weak to go to school. Tabo's mother began to cough. On a rainy morning while hanging the laundry, she spat red blood onto a clean blue sheet. Terrified, she returned to the clinic, where she found that she had TB. But worse than that, the strain that she had was resistant to first-line drugs.
Ladies and gentlemen, please welcome the lady.
I'm here. I would be more joyous with the welcome, and I would respond far better. But the story of Tabos is such a heart-wrenching one that it's a little bit difficult to do that because, again, as I say, I've seen this so often. Tabo developed a fever and would sweat terribly in the night. He was too weak to go to school. Tabo's mother began to cough. On a rainy morning, while hanging laundry, she spat bright red blood on a clean sheet. Terrified, she returned to the clinic, where she found that she had TB. Worse, the strain that she had was resistant to first-line drugs. The clinic referred her to another hospital, but without money to go there, she hiked back home. Over the next weeks, Tabo and his mother became sicker and weaker. They barely ate. His aunt finally came up with the money to go to the clinic. Everyone was frightened by the way the doctor stopped everything and moved quickly to Tabo's side, shouting, basically, "This boy is critical," and everybody moved to let him pass. He found large lumps in Tabo's neck and fluid in the boy's belly. "They must go to another hospital now," he shouted, worried so much that he even gave them taxi fare from his own pocket. When the hospital medical officer in the new hospital saw Tabo's mother's papers from the clinic saying that she had drug-resistant TB, he ordered her home. He was frightened for his other patients, and he did not have medicine anyway for patients with drug-resistant TB. They lay in the grass outside the hospital and waited for days. Tabo's mother died there. A nursing sister who knew Tabo's family found him, barely able to lift his head, and drove him to his auntie's place. Tabo still sweated in the night. His body still shook from chills. The lumps in his neck grew bigger, and he too began to cough blood. He grew smaller, but his belly grew bigger. He was visited every day by a worker from the TB clinic, and he took the medication in spite of the fact that it brought him nausea. It was just a few hours after receiving the drugs that Tabo died, alone in a corner, covered in flies. "At least they gave me the money for the funeral," his auntie remarked. "At least this way, we can finally do something nice for Tabo. We can give him a small place to rest and to know his peace." So this is a story which I have seen play over and over and over again. It is heart-wrenching, and it is the hard, horrible face of tuberculosis. At Seattle BioMed, we've built a TB program in the last 5 years with the generous help of many of you, and TB has become a major priority for us. As I mentioned before, a third of all people alive today are latently infected with TB. These cases can switch to becoming active disease, and yet we know very little about the transition from the latent form to the active form of TB. We could understand this switch, we could target it, and we could begin to break the back of this epidemic. Using systems biology again, a team of Seattle BioMed scientists and their collaborators began to address this complex problem. They have developed a detailed gene network that allows us to model TB behavior in an unprecedented way. They are now using this model to identify the latency switch, and new drug targets are being found. This work has been led by David Sherman. David, would you and your group stand up and be recognized? The collision between HIV and TB has resulted in a perfect storm. HIV weakens the immune system, resulting in the transition of latent to active TB. People who have AIDS are much more likely to become infected with active TB, and as one might imagine, this has had many consequences, both personal and social. To quote Nelson Mandela again, "We cannot win the battle against AIDS if we do also not fight TB." There are additional consequences to the collision between HIV and TB. Injudicious drug use has led to drug-resistant TB. This occurs because the drugs have to be taken for a long, long time. They have side effects, and when you start taking them, you feel better, and then people tend to stop taking them because of those side effects. This leads to drug resistance. So first we had multi-drug resistant TB. This is because the drugs, the drug-resistant TB was only multi-drug. We still had some drugs which could do the job. Then we had extreme drug-resistant TB. This was a very, very serious disease, but there still was some hope. Now we have totally drug-resistant TB in Africa and in parts of India. Totally drug-resistant TB is basically a death sentence. And we in the US are not immune. All we need is for somebody with totally drug-resistant TB to get on a plane in Dakar or in Johannesburg. Air is recirculated in planes, and by the time that plane gets to JFK, it is quite possible that many people are infected. And everyone spreads out from the hub. And soon this totally drug-resistant bug is winging its way to all parts of the country, including Seattle. It's a very, very dangerous situation. Now, everyone here has a story and a reason to be at Seattle BioMed. And everyone in this dinner tonight have a story and a reason to be here too. I too have a reason. My reason goes back to South Africa, now the epicenter of the collision between HIV and TB. These infections are doing what apartheid was never able to do. breaking the will of the people, and destroying the country. I grew up in the apartheid state. I fought against it. I went to prison for it. I was banned and house arrested for 5 years. I lost very good friends, including Steve Biko and Neil Agate. It was a tough fight, but it was worth it, and we won. The fight against these scourges is much tougher. All of us basically need to get into the trenches here. Making vaccines and drugs against TB, HIV, and malaria is an extraordinarily difficult task. We need to be creative, we need to take risks, we need to recruit the best, and all of this takes resources. We have a fantastic group of dedicated scientists, people who are as committed to the cause as they are committed to the science. Please join with us to change the world. Once again, I will quote Nelson Mandela, "It always seems impossible until it's done." Thank you.